It is the drug of choice for some Michigan patients and their doctors. But even though voters approved it, medical marijuana is still controversial.
Our Leslie Tolto is here to explain why the drug that is still illegal in most of the 50 states is gaining popularity as a treatment for some illnesses. Leslie?
Marijuana, pot, cannabis, whatever you call it, there are a growing number of people who rely on it to fight pain, survive chemotherapy, and make it through the day.
And I just drop a little in, and I'll just hit it once, and then I'll be good for a minute. If I was to take synthetic medication, I'd be taking a Vicodin every 3 to 4 hours, an Oxycontin every 3 to 4 hours. To be able to hit a pipe or eat a half a brownie or something every couple hours is a lot better to me.
For Julie, marijuana is simply a natural alternative to prescription drugs she would have to take every day to manage a myriad of illnesses, including multiple sclerosis, degenerative disc disease, and diabetes.
That's a lot of difference. If I was to take all of the pills that are prescribed to me on a daily basis, I'd probably be in the area of about 50.
Julie is among thousands of people in Michigan who are legally certified to use medical marijuana. But in 36 of the United States, it's against the law, no matter how sick a person is.
It's a Schedule I narcotic, but it shouldn't be.
Dr. Robert Kennewell, known in his advertising as Dr. Bix, travels Michigan. He is one of a relatively small number of practicing physicians who help patients get certified to use medical marijuana.
I think on the scale of harm, I think our potential for doing harm with cannabis is much less than the potential of doing real harm with things, say, like OxyContin.
Kennewell says marijuana is less addictive than other drugs, and that while hundreds overdose on prescription drugs every year, the number of marijuana overdoses?
0.
So how did marijuana get what advocates describe as a bad rap? To many, it started with this film, Reefer Madness, that came out in the 30s, a propaganda piece showing scenes of crazed people smoking pot, becoming violent in some cases.
Alcohol prohibition was going to end. A bunch of federal agents were going to be out of jobs. They needed a new job. They villainized marijuana. I mean, that's my own take on things. There's a disinformation campaign, an active disinformation campaign that was conducted during the 1930s.
It is what many believe has helped keep research down on cannabinoids. The most well-known is THC. Cannabinoids are the active ingredients in marijuana that work on receptors in the brain.
It's not about Cheech and Chong. This is about your aunt or your mother or your somebody that you love that's dying of cancer and can't hold any food down, or it's about the patient with chronic and severe pain that's ready to commit suicide because it's so severe.
Right now, it is legal to use cannabis in Michigan for about 15 conditions, ranging from chronic pain to nausea to seizure disorders. But it's only legal for patients who carry one of these, a state registry card, like Julie.
We're not a bunch of young children walking around just wanting to get a drug to get high.
And not everyone using medical marijuana is smoking it.
We wouldn't typically advise people to smoke anything, be it tobacco or cannabis. Smoking's dangerous.
There are special vaporizers, and topical cannabis oil is believed to be helpful for some skin conditions. And you can cook with it. Just about anything you can imagine.
We used it in spaghettis and chilies, and you can dry it, you can freeze it, you can bake it in breads.
But first, you have to have it. And if you have a patient certification card in the state of Michigan, you are allowed to grow up to 12 plants for your personal use.
The Free Leonard is more of a heavier medicine. It's more of, they call it a couch lock medicine.
Just as there are a lot of different ways to use marijuana, there are a lot of different kinds, called strains, with different levels of cannabinoids in them.
There's certain kinds where you can smoke it in the morning if you need to, and you can be up all day and got energy and thinking clearly. And then again, there's other strains where if you smoke it, it'll put you right on the couch for the rest of the night.
That is something Joanna, a chronic pain patient, and her husband Paul are learning a great deal about. And the versatility of marijuana, the drug, is something advocates are hopeful everyone else is willing to have, at the very least, an open mind about.
If you control this drug, as it probably should be, as a medical therapeutic, it becomes seen less and less as a sexy drug for kids to be attracted to, and it becomes seen more and more as what it should be, which is something that's useful for different medical conditions.
Not every medical marijuana patient grows their own. In fact, in Michigan, people can be licensed as caregivers for up to 5 patients, 6 if they're patients themselves.